Welcome back to another episode of Conversations from Stritch. I'm really excited to be with you today. My name is Dave Livingston, president of Lewis University, and I'm joined by Dr. Christopher Sant, our provost. We are excited because this is really, from my point of view, episode 1 of our new season for FY22, so for the 21-22 school year. And we're excited to be back with you. We'll be doing weekly shows most of the academic year. Today, I've been really lucky to have been watching some of the presentations from our SURE program this morning, and actually had the opportunity to be able to speak to the students who are involved in the summer undergraduate research experience. I will say that I made a little math error in my presentation, which is not unusual for me, and I always have to have people correct me, but the work that is being done by our students is really amazing, and we're again grateful for the support of Dr. James Gerard and his wife Constance for all their support that made it possible for our students to spend the summer researching with their faculty mentors. It is just about to begin. The new school year starts soon. Welcome Week begins Monday, August 23rd, and we will present a multifaceted program to welcome the Lewis University's newest students, orient them to campus, and transition many of them into the residence halls while providing opportunities for new and returning students to meet new friends and to launch the 21-22 academic year in the LaSallian spirit of association. First-year students move-in will also take place on Monday, August 23rd. Any volunteer out there, faculty, staff, can help out, would be much appreciated. During the day, there's a commuter welcome that's scheduled from 2 to 5 in the JFK Recreation Center, and an ice cream social on the University Green from 4 to 6. Faculty and staff are invited to come out and welcome our new families. There are also numerous activities scheduled throughout the week, including academic sessions designed to help students make the transition back to classes. As always, we invite your participation and encouragement of our students. Show the welcome. The other thing that I want to remind people of, because as I've been driving into campus every day, there have been these big bins that are for dumping garbage in that are right outside of North Hall. So renovation has begun. They're kind of tearing out some drywall, and one of the floors in North Hall will be offline this whole year. The process is going to take us 3 years because we're going to do it in a phased approach. So for the next 3 years, there'll be one floor that'll be offline. North Hall was built in 1997, and it'll be closed in phases for this project. It'll remain open in terms of having students living there, because as we remodel it, we'll open up the floor that just got remodeled, and then one of the old floors will be there and one floor will be remodeled. So the remodel will include updated bathrooms in each suite, installation of electronic key card access for each suite, updates to the common use kitchen areas located on the second floor, updated lounges, new lounge furniture, and improvements to the HVAC system. So it's an exciting project that we're really looking forward to getting started. We know there's always, when we do construction, a little dust and mess, but we'll deal with that. So with that, I think I'll turn it over to Dr. Sant for some other announcements.
Thank you. Wonderful. Great to be with everyone today. And great, again, I was also at some of these SURE presentations this morning, and it was just such a pleasure to watch our students reporting on their work, presenting their findings from their summer research. It was really inspiring. I learned about rockets, coastal change, and some math stuff I did not understand. It was great. So fun to watch our students present. And I actually did understand a lot more after listening to our great student presentations. So we have a few news updates as we bring the summer to a close, and then we'll transition into our focus for the day, which is our preparation for COVID-19 in a great and healthy fall semester. So congratulations and thanks to Brother John Vitoris, who was a guest on the WGN radio show with Jim Toreno on July 4th. And on that day, he shared his insights around the Declaration of Independence and how the process of American independence came about. We're also really excited about The Life Along the Canal, The Art of John M. Lamb, which is an exhibit on display at the Gaylord Building, a National Trust historic site in Lockport. The exhibit, which highlights the work of our Professor Emeritus, John Lamb, was recently featured in the National Trust for Historic Preservation's award-winning Members Magazine. The exhibit continues through the fall, so please go check that out. It's really cool. It is also the result of the collaboration between the Gaylord Building Historic Site and our own Edelman Regional History Center. And would you like to announce some
Yeah,
more
so
news?
we have a couple other announcements that have been going on, that have happened over the last few weeks as we've been off. So Dr. Nanci Reiland, Chair and Professor of Sociology here at Lewis, recently served as a panelist on resilience during multiple epidemics, centering Black women and girls' experience and responses to COVID-19, gun violence, and police violence in Chicago. During a regional spotlight session for the American Sociological Association 2021 virtual annual meeting. We could, and we do, we could go on and on about all the different presentations that our faculty do. We really do have an incredible faculty here, and Dr. Allen is one representative, and we're really excited that she was able to present at their annual meeting. But of course, each discipline has their annual meeting, and we will use this as an opportunity to continue to talk about the great research that our faculty are doing. On the sports front, the College Sports Information Directors of America announced on Thursday, August 5th, that Lewis University's Ryan Coonan was named to the COSIDA at-large Academic All-American Second Team. As selected by COSIDA, he becomes the 5th player in the history of men's volleyball program here at Lewis to achieve this honor. Now, before we introduce our guests, we're going to be back in just a minute, but we're going to have a little quick video here.
Well, thank you everyone for that. Whoever produced that, all the people who worked together to produce that beautiful video. And we're glad to be back, and would now like to introduce our guest, Dr. Nanci Reiland, Professor of Nursing and Specialist in Community Health. We've introduced her many times before. She's a frequent guest with us today, so I won't do a lot of that now, but welcome, Nanci.
Thank you.
And of course, Nancy's here to help us talk about the preparations for the fall semester and our reflections around how COVID-19 is going right now. And this is fairly casual among us, just to kind of talk through some of the things that we're planning and maybe some of the implications of those things. But to begin with, we do have a few visuals to remind the community about and to announce some new decisions today. So if we could see that first one, I'll start going through some of those now. So first of all, we will, and we could go to the next one. Just to remind you, the fall semester is in preparation. Our classes in the fall will be in their standard room capacities. We do have many more hybrid and online course options than we had in the more distant past in our course schedule, and that's something we will continue to do into the future, but that is, we still have that built-in flexibility for the fall semester with our scheduling in almost all cases. we've been working really hard through last year and through the summer to both increase the in-person student services and student life activities we have, but we will also have learned from all kinds of cool techniques for reaching people virtually and reaching a more diverse and broad selection of our student body through virtual activities and meetings and so on. So we still plan to do that, to do those as well, while having many more students on campus enjoying themselves together. We put the numbers for the residence halls on the screen just as a reminder. We had about 1,100 students a few years ago before COVID. Last year we made adjustments in the rooms and in the room assignments so that we could have more space and flexibility. And now we're going not all the way back to the original capacities, but adding about 100. There'll be about 100 more students in the residence halls this fall. The next set of things I'd like to announce is more, some of which will be new, and some of policies are beginning tomorrow on August 13th. All of these policies apply tomorrow. Some of them are new, some are not. A reminder that vaccinations are required. Students and employees must submit their COVID-19 vaccination status on the Lewis U app or online at the link for students and/or faculty and staff, depending on who you are. The flyers promise an acknowledgement, which came out, which is available, and it was in my email last week, is mandatory. Residential students are required to submit this acknowledgement before moving into the residence halls for the fall. All students are required to submit the acknowledgement form before the first day of classes on August 30th. A reminder that we are a face covering friendly campus. Lewis is a face covering friendly campus, a place where individuals feel comfortable wearing a face covering for any reason. And now here's our new announcement. Face coverings should be worn in public indoor spaces, and this includes, starting tomorrow, classrooms and common areas of residence halls. This policy will be in effect until September 10th, and we'll talk a little bit more about this later. We'll continue to make announcements about whether or not that and other potential policies or mitigation strategies will be in effect after September 10th as that time gets closer, and it will either be extended or altered depending on how things are going in our community. A reminder that many things have not changed from last year. You need to report symptoms or a positive test if you're experiencing COVID-19 symptoms or receive a positive COVID-19 test result, regardless of your vaccinated status, and students, faculty, and staff should report them to the COVID-19 hotline team through the app, through our phone number, 815-588-7000. That's always in my emails that I send out every Thursday, and through the COVID hotline email address. So, and then the last set of things we want to talk about, and then we'll just sort of talk about it, things with Nanci and all of us together today, is the mitigation strategies around, oh, I'm sorry, I skipped something. We still have 2 more policies for unvaccinated students and employees that differ from the policies for vaccinated employees. So only unvaccinated employees still need to go through the daily health screening that we all did last year. And then residential students, when they are moving in, must submit a proof of a negative COVID-19 test before move-in. And now we want to talk a little bit about the metrics we will be used to get us to where we are today with these announcements, and also to make alterations for our decisions in the future. So we've listed 4 general areas on the screen here, and those are the ones that when the COVID hotline team is talking, or when our leadership team is talking and about how to get a sense of our community's risk and relative ability to do things, these are the things we're talking about the most. So the recent CDC guidance around face coverings for vaccinated individuals in indoor settings, which came out 2 weeks ago, roughly, or 3 weeks ago maybe, uses the metric of cases per 100,000 in your county. So the has several zones that are marked by colors. The orange zone is 50 to 100 cases per thousand, and the red zone is over 100 cases per thousand. And that CDC guidance applies to counties that are in the orange or red zone. So vaccinated individuals wear face coverings indoors when they're in the orange or red zone. So yesterday, the last time they updated the numbers, the count in Will County was 156, which puts us in the red zone. So that's a big factor in thinking about why we're making this decision or announcement today about the decision with face coverings, as well as if and when that count decreases is how it would impact whether we would release some of these mitigations. Other factors include our own internal community. We have had a couple of cases reported over the summer. You know, it's been a really long time, since early May, since there are multiple counts. I mentioned it earlier, but this is a reminder of how important, or this is another piece of context about how important it is to report positive cases, because we are making decisions based on reports of cases to the COVID hotline team. And so we need those numbers to be accurate. We're also just interested in vaccination rates. This is the final thing I'll talk about before I stop talking. The vaccination rates in our community are important because our staff and faculty and students are moving through in and out of our community all the time. The last count that I looked yesterday was 47.7% fully vaccinated individuals in Will County. That's a little bit below the national average and a little bit below the state number. And then finally, and really important, the vaccination rates in our own community. So I'm just sharing some updated information here. It really changes every day. And Nanci probably even has more updated than this, because this is from yesterday. But I've just broken this into 4 categories. Full-time employees and GAs are one category that we're tracking, and of that group, 93% of that community has already reported their status, and 95% of that group is vaccinated. Adjunct faculty are not in that group, so as a separate group, 85% of adjunct faculty teaching in the fall have reported, and 84% of that group are vaccinated. And then for students, 57% have reported so far, with 85% of that group reporting having been vaccinated or started the vaccination process. Among that group, the residential students who are moving in sooner, 76% have reported so far, and this is as of yesterday, with 90% vaccination rate. So just looking at that list, it's a lot of really, really good news around high numbers of vaccination rates in our community, and with one concern, which is the student compliance with the vaccination reporting policy. And so we know that people are, we've heard, and Nanci can explain more about this, but people might have gotten their first shot and they're waiting to get their card to post, or they're vaccinated and they're just know that it's a really quick process to report, and so they're waiting until before school starts to do so. But we really want to encourage students to report your vaccination status as soon as possible. And if you are someone who would like to discuss a exemption, please do that now, because that is a little bit more time consuming and so on to work through that process. So I will stop.
So
take a breath.
First of all, take a breath, and we'll give you a little break. Once again, thank you so much, Nanci, for joining us. As I think anybody who watches this show regularly knows, that we've had Nanci on the show multiple times. I guess I'd like to start, Nanci, with a question I have and I think there's 2 layers of maybe the conversation we can have today. One is what we can offer kind of general public information, meaning there are people that have questions about certain things that are general. And then, of course, our community, the Lewis specific community. So, and these are tied together, but I'd love to hear, maybe have you talk a little bit about, because I think it's still confusing the recent CDC guidance that came out, now it's been, 3 weeks ago or so? And if you could talk to us as a public health professional about what you think the CDC is trying to achieve with talking about wearing face coverings in public settings, indoors, and kind of where we're at with the virus and this Delta variant. So kind of maybe you could just give a little summary of kind of where do we stand with this virus, and how do you see that, and how can you just kind of, and then we can focus more deeply on Lewis specifically.
Right. I think we really have to, I've used this term throughout the pandemic, bring back our humility of what we know and what might be coming ahead. So the Delta variant has thrown some loops or some knots in the loops, and I think that guidance that came about was really based on maybe vaccination numbers that aren't where we would like them to be, and then the resurgence of cases in the area, and including in those cases, some cases of people that have been vaccinated. So that's called a breakthrough case. And we kind of knew we should expect those because with any vaccine, they're not 100% effective on every person, especially people with immunocompromised systems. They may not build up the degree of immunity that others would. So when we looked at the efficacy or the effectiveness of even the Moderna and Pfizer, those were in the 94 to 95% range. So we should anticipate that there's 5 to 6% of people that may actually still get infected if they've had a substantial exposure. The Johnson & Johnson, or sometimes called the Janssen vaccine, has a little bit lesser efficacy. So there may be more people that may have had this breakthrough infection. But the good thing is these infections are usually less serious, less people are hospitalized, and very few, if any, have died that have been vaccinated and then infected.
So could we just emphasize that point? Because I think this is another place that can be confusing for our population and certainly the broader population, which is we are still recommending, the CDC is recommending you as our kind of one of our primary people who help us to make sense of what's going on with this. The vaccination is the best way to kind of prevent hospitalization, to prevent death, to take care of the broader community. And I guess I just wanted to, 2 underlines, exclamation point, because I think there are people that I talk to out in, kind of the regular world, my regular life, that say, well, if we're going to have to do the same things, why would I get vaccinated? And I think it would be helpful for you to talk about how, in some sense, we're not doing the same things, and people aren't at as much risk when they're vaccinated. And I think really importantly, the healthcare system overall is not at as much risk, which was a big driver of this whole thing, that we want all of our hospitals to be able to function at capacity, and the virus really caused some problems with that. So maybe you could speak a little to just the average, because when I say this impacts our community, the 7,000 people that are part of the Lewis community, and the broader Will County group.
Right. Across the country, across the world, of course, different levels of intervention that are having to go on. But I guess the best way to look at it is if we had the perfect scenario where we could have gotten everybody protected, so vaccinated within a certain amount of time, we wouldn't have had viable hosts that this virus could have infected and then continue to spread and continue to mutate. So that we're losing that timeline of a lot of folks that maybe had some natural immunity from an infection, and may or may not have gotten or have not gotten vaccinated, and then those that are not vaccinated nor have had an infection. We have a lot of susceptible hosts out there. We have, those under 12 that cannot be vaccinated. So we know kids don't generally get as sick, although we've been seeing more and more cases with the Delta virus of kids being hospitalized. But they are, little carriers of the virus. So Knowing that we have some people that are vaccinated that are still at risk, knowing that we have a substantial, a good amount of the population that is not vaccinated. We have a lot of different people that this virus, and again, bringing that humility. We don't know, we know a lot about the virus, but we don't know we know its intention is to infect people and to keep living. We don't know its MO of how it's really going to go about doing that. And so we have to be, when we see these blips, or we have, this time period where an action such as putting a mask on, which we've done it for a number of months, we've gotten used to it. We've found our favorite mask. We know what we like and what we don't like. It's a small act that we can do to really help us get through, and again, learn more about the virus, learn more how, boosters that came up today, being talked about, those that may not have built up adequate immunity, they likely will be in line first for a booster, and we'll get more guidance probably in the next week or so on that. But the masking and, limiting our close, our real close interactions in a mixed group when we don't know vaccination status, or, especially indoors, might just be prudent things for us to do so that we come out of early fall in a better position than where we were late fall last year.
That's great. This is maybe a good time to remind viewers that you can write in questions to the Ask Us at Lewis U app that's on the screen there. And just since you've been talking about vaccines, I think I might just announce the vaccine clinics that we have coming up, and then we can talk a little bit more. So we do have a COVID-19 vaccine clinic available for Lewis University students, faculty, and staff, as well as their families, from 11:30 a.m. to 3 p.m. on Sunday, August 15th in the Red Room in Memorial Hall on our Romeoville campus. And then a second dose of Pfizer will be available from 11:30 to 3 p.m. on Thursday, September 9th in that same place, the Red Room of Memorial Hall on our campus here in Romeoville. So please visit the links that are maybe we're going to show on the screen, and there certainly will be in my email sent out this afternoon to sign up for that August 15th vaccine appointment. And there are some choices there. And then I presume, Nancy, walk-ins will be available depending on supplies and how full the reservations are, and so on. So that's great. So we're doing our own vaccine clinics on campus. There are many others available in the community, and we have links to those on our COVID-19 webpage. They're certainly available, so it's about making that choice, and it is a requirement for Lewis. So knowing that there are a lot of different opinions and feelings and attitudes about getting the vaccine, Nancy, I wonder if you could just reflect a little bit about what you've experienced around that. And maybe, I know you taught a class this summer where some students did some work around communication and education. And I think we'd all like to hear a little bit about how to go about, how you've gone about that.
Yeah, this is, I guess, one pandemic blessing. It's been a real joy to be able to teach community and public health in the last year. Our students have gotten so much wiser, and the application of what they're learning in class, they've been real trailblazers, and I have to say I'm really proud of them. So let's start with just the vaccine confidence or lack of confidence or hesitancy. Yeah, there's been quite a bit of that, and data shows that our young adult population is one of the groups that is expressing most of those concerns. And we need to validate that this isn't, this is new, especially for a young adult. This is probably the first time they've really had to discern, am I getting this treatment, this vaccine, going to the doctor, whatever it might be. So it's a new process. So there should be some, I guess, intrepidation of what does that look like? What kind of information do I need before I make my decision? So that's a good thing. So we encourage people to really talk out their anxiety and their fears, and the information that they have and where that information has come from. So we do have a group of student nurses in their upper level undergraduate courses that have been training as, we're calling them peer student vaccine ambassadors. And they'll be available at vaccine clinics, welcome week, to have a table that you can, stop in whether you've been vaccinated or not, to ask the now what's, or I need some information for my brother, or we have younger kids in the family, when is the vaccine going to be available? So they'll be there to answer those questions. And they're also going to be doing some outreach to our students that have requested exemptions for various reasons, just to make sure, yes, we'd like to get our vaccination numbers way up, we'd love to be near 100%. We know that's not the reality. Our outreach is really in concern for our students and making sure that they have the most credible and fact-based information. One concern, students may say, I have a family history of something or other, or I have a history of. And really that history from a medical standpoint is something that puts you at greater risk of the infection itself, not the vaccine. So we want to make sure that you're, have the information you need to keep yourself safe and protected for yourself and your family, and to talk through those concerns and, the information that you're getting. We keep getting updates. This week, the American Association of the Obstetricians and Gynecologists and some other maternal health organizations just kind of upped their recommendation. Before, it was kind of a neutral recommendation. They didn't say don't get it if you're pregnant or want to become pregnant. They didn't really have a statement. But now that we have a lot of data on women that have become pregnant or were pregnant during the vaccine, we've learned that there's some transmission of antibodies to a newborn that gives them some protection if their mother has been vaccinated. So that has prompted those organizations to actually go out and recommend. And so that's been a concern for some of our faculty, employees, and students, saying, I'm planning on getting pregnant, I'm breastfeeding, but now those recommendations are really positive in to protect yourself and your baby. And we know that pregnant women that's a comorbidity. They are at increased risk for severe complications if they do become infected.
Yeah, Nanci, I guess, one of the things that I'd like to maybe hear you and Chris talk about, because I think this is something that Chris announced earlier, but he's been spending a lot of time on, we as a whole community have. But this public nature, so in the CDC guidance, it was about, wearing face coverings, the announcement that we're pushing forward. So I'm an employee here. And I think, we're gonna have students coming back, and we'll be talking about this more as students come back, and I know some of them are watching right now, but so we're gonna say, wear a face covering in a classroom. Wear a face covering if you're in a public space in which there are a lot of people around that you don't know. And then we're also saying that if you're in your own office, doing your work, your normal work, you don't have to wear a face covering then. So could you talk a little bit about, maybe a little bit of kind of the science behind what public means, and then the science behind it and what they're trying to achieve in terms of keeping our community at Lewis safe, but keeping the broader community safe?
Yeah.
And either one of you, because I know you've been working a lot on this.
Do you mind if I
Yeah, go ahead.
Please
answer the first question? Because
Yeah.
it's really a legal question more than a science question. So public space is a space where anyone in that is accessible, that's owned by a nonprofit like a university or a private business like a supermarket, where the public has access to and could congregate or come together, people from different backgrounds. So in our interpretation, and this is sort of more becoming more standard across universities responding to these guidelines, that includes clearly public spaces where we do events. It includes hallways where in just about any of our buildings where people may come in. And we're also interpreting it to include classrooms. The residence hall distinction I made, so our residential students in their own rooms do not have to wear face coverings. If they have guests that they know entering into their own rooms, they do not have to wear face coverings. We may have further mitigation or conversation about that. We encourage people not to do, especially external guests in their rooms and so on if they don't know them well. But the common spaces in the residence halls we're considering public spaces. We just got a question from an employee around, what about spaces where we serve students? And so I would say the answer to that is certainly yes, those are public spaces. And so if there's an office, we have so many different office configurations on campus, but if there's an office that has a accessible window or students have to walk into the office in order to get served or help, that would be a face coverings required environment. And if there's any way to separate the back end of the office, and again, all of our offices are configured differently, then they would not be required. So if it's employees, and again, we have a very high compliance rate and a 95% vaccination rate among our employees. If it's our own internal employees having a meeting or working alone in an office, it will be similar to last year where face coverings are not required. And because we are vaccinated as a community of employees, we're much more open to a meeting with face covering optional thing as long as it's not a public space. So that now what was the second part of the question that Nanci was going to answer?
Then for me, and really helpful. Thank you so much, Chris. And I know you spent a lot of time on this. And I guess I want everybody to know that how grateful I am, Nanci, to Chris, to everybody on the hotline team, to everybody on, there's multiple task forces. I don't need to go through all the names. Everybody that's on them knows the acronyms. But let me just say for those of you not on one of these task forces, the incredible work and the hours and hours and deliberations that have gone into these. So these are not decisions that we've made lightly by any stretch of the imagination, and we've taken the best science into account. So I guess going to you, Nanci, with Chris's kind of explanation about what a public space is on our campus and how we view that, could you talk a little bit about, we gave vaccination rates, we talked about that kind of trying to develop a community. We've talked in the past about herd immunity. That was a word that I think we all got used to 12 months ago that maybe many of us didn't know. But maybe talk a little bit about the public health view of why CDC is making a distinction between public spaces and private spaces, and really that they're also making this distinction between outdoor space. We didn't talk about that, but to name it, we're not expecting face coverings in any outdoor setting. So this fall, obviously I want to go back to, we're a face covering friendly institution. So if you go to a soccer game, second week of September, outside, you're not going to be required to wear a face covering at that event. And we want everybody to feel comfortable wearing a face covering if they're at that event because they are in a public space, but they're in an outdoor public space. So could you talk a little bit about outdoors, indoors, and then kind of this notion of, again, what we're trying to achieve, the CDC's trying to achieve, and we're trying to achieve?
Yeah, it's a real balance. It's a balance between, there's so many factors. We want to give people, the choice as far as vaccination in instances where they can. There's certain places that are mandating, as we are here, but we also know that there'll be those asking for exemptions. So we understand that we're not going to have 100% protected rate, and even if everybody was vaccinated, again, not everybody built up the same amount of protection. So we know there's still people at risk for both harboring the virus and being infected with it that might get really sick. So we have to look at that balance between our freedoms and protection. And we know, at least from what we have some evidence with the Delta virus, it's much more transmissible, so more contagious than the other variants. So that idea of indoor space, people close together, all the things that we were saying, don't do early on, even with the other alpha, the beginning variants, we know those are higher risk places. We know we have a group of individuals of a certain age that can't be vaccinated. So just anecdotally, just seeing some of the meetings that have been going on campus, I think is what we're going to see. And I think it's it's a very human response and a very Lassallean response to be in a group where some people, even if they're vaccinated, are staying masked. Some of them will share because we're colleagues, we're friends, and it might be, my kids can't get vaccinated yet, and I want to be extra cautious. I have somebody at home that is on, chemotherapy. So whatever that reason is, whether people, share, it doesn't need to be, but we should be in a open, trusting relationship with each other that, if people want to share, and we validate that and we respect it. And, I've sometimes said, well, do you want me to put my mask on? And sometimes they'll say, well, no, that's okay. I just want to be, more cautious myself. Or you're just more aware when you're with somebody that has shared maybe an increased risk that you're keeping a little bit more space. It's all about, again, the space we're together, how long we're together, indoors, outdoors, and whether we have some sort of protection. Of course, both sides having protection is the ultimate, but now as we move into this kind of new normal, we're probably going to see a variation, some people masked and some people not.
It's great, really, I think really helpful. Chris,
And if I could add maybe
thoughts?
one thing to that, the duration of classes is a factor in that, making this decision about requiring face coverings in classes, because it's, we were very, very successful all of last year with not having transmission in classrooms with face coverings in place, but it is a longer amount of exposure than a visit to the bursar's office or something like that, where it's a 2-minute transaction and so on. So we're requiring face coverings in both of those examples, just to be clear. But even though classrooms might be considered, more protected or private spaces with our internal community, we're still erring on the side of caution around requiring face coverings there.
And just I guess another, I just want to reemphasize, it was all said at the beginning, but I always find, this is the teacher in me, I want to just repeat things. So these policies that we announced today are in place minimally through September 10th.
Correct.
As we lead up to September 10th, and Dr. Sint will continue to put out his weekly COVID announcement, so you'll be able to receive that email, get a sense of what's going on. But as we approach September 10th, about a month from now, and I will say that we're also going to have this huge influx of all these people. So, we haven't all been together, so we're going to go from, hundreds of people on campus to thousands of people on campus every day in the next few weeks. So we want to let that kind of settle down and make sure, again, want to reemphasize a couple things. Reporting, very important. So if you have symptoms, if you feel sick, if you get a positive test, please let us know, because we need to base our public health policy at this university on data. That's what we've said all along. We're going to listen to the professionals, CDC, Illinois Department of Public Health, et cetera. And then I guess the second thing I want to say is that in addition to kind of letting us know, we're going to then evaluate all that information. We're going to use the best knowledge that we have. And as we lead up to September 10th, we may say this is going to extend for 2 more weeks or 4 more weeks. Or we may say that we are no longer going to require face coverings in this type of setting. Or we're going to add additional face coverings in this other setting, because it's going to depend on the data. And I think that's really important for everybody watching to know that this is done with a real sense of what Nanci was just saying, which is this balance. We're trying to balance people being able to have the lifestyle and the way of being in community, because association is very important to us, being with each other, and balancing that with the public health of each other, taking care of each other, and taking care of the broader public health system. So I don't know if either of you have any reaction to that, but that feels to me like those are key elements that we want people to be aware of as we move forward?
Yeah, I would just add one thing to that great summary. Vaccinations are required. You must go through the vaccination reporting process. We know who has and who has not done it, and we will follow up with everyone who has not done it. And if there is a need to request an exemption, you do it by going through that process. So all individuals have to go through the process of reporting their vaccination status, and it is a requirement. Do you want to add anything?
Yeah, can I just add, I don't think with the peer ambassador project that we're doing, just ask if you do receive a text or an email or possibly a phone call, and the person identifies them as a Lewis University vaccine ambassador, please take that outreach and interact with them. They've been trained, and hopefully, and this is in a way, a clinical practice for them. So you're helping them to become a better nurse and communicator. But it really is meant to be a welcoming ear, somebody to listen to your concerns, to maybe reflect back what they've heard, and provide some resources or information that may help you in your discernment and provide support. So that's really what it's meant to be. They're not going to say at the end, are you getting vaccinated or not? It is an engagement, and so we really hope that that they will be respectful to you, and we hope that you'll be respectful and give them that time to interact with you.
Great.
Yeah, I think that's
Great.
That's all. Just I'm so grateful for everyone's work, Nancy's work, the COVID hotline team's work, as well as all the members of our community who are helping us stay safe. So thank you, everyone.
Can I
Yes.
present you with?
Oh yes.
Oh,
Oh yeah.
yes.
We have a ceremony.
Some hot off the press.
Thank
some
you.
And I am
vaccination awareness buttons and pins that we'll have available throughout campus. So we'll different opportunities where if you're vaccinated, you can pick one up and wear that with pride.
I am happy to put that on, as I have been vaccinated for quite a while. So we do have some announcements about winners, yes?
Oh, I forgot about that.
So,
Yes.
Yeah, so I want
I
to
don't
make
know
sure.
if we have a graphic of our winners.
Yeah, I
or
don't know if
can
we
read
have a
them.
graphic of our winners or not, but if we do,
I
if
will
we
read
could
them.
put up the winners. If not, I'll ask Dr. Sent to read them. Oh, submit it to win it.
Here we are. So thanks for that reminder. Since we're here, we'll send this email. Will go out today to the community as well. But we're very pleased to announce our vaccination prize winners for this week. And just a reminder, you become qualified to win these prizes by submitting your vaccination status, as I just talked about a little while ago. Every week we do the raffle, and the everyone who's already vaccinated is included every week. And then if you enter into the list of people who've gone through the process this week, then you're added to the list. So this week's winners are Anthony Joyce, who wins Adidas sunglasses, Lucy Clark, who wins a television. I'm not going to read that complicated, 43-inch television. Gina Russo for Sodexo dollars, Ryan O'Connor, athletic swag, Joseph Koenig, $100 Amazon gift card. Sorry, Joseph, to get you too excited. And Johan, I think it was Gonzalez, who won a Wi-Fi hotspot and a year subscription of wireless service. And our faculty staff winner of the week is Napoleon Garcia. Congratulations, Napoleon, who won a choice of a gift card or Lewis Bookstore apparel item. So thank you very much, and thanks for the reminder.
Oh no, I'm really excited.
do that.
Again, a reminder that everybody gets to, if you've been vaccinated, you're in this pool every week. So if you didn't win the TV this week, you could win the TV next week. So I do want to just thank Dr. Sint, Dr. Reiland for being on the show today. I think we really had an opportunity to have a little more in-depth conversation about what's going on with the vaccine. I am thrilled. I must say, I'm so excited to have people coming back. We have student athletes, RAs, those kind of people starting up next week, and then it'll all just accelerate, exponentially, as we talked about at the beginning. Welcome days and move-in days first day of classes, convocation for first-year students, and for faculty and staff. So I would say pay attention to your emails because there's going to be a lot of announcements about what's going on in the coming weeks. But we are thrilled to have everybody coming back. We're excited to have now a weekly show schedule return. So we will return next week on Thursday. We will be excited to be back with you. And thank you so much for taking the time to join us today. We hope you learned something about the vaccine. Please get your vaccine, turn in your status, stay safe and healthy, and God bless you and your family.